Intelligent and industrious, highly skilled in medicine and technology, with a creative, innovative and visionary idea and an unorthodox way of thinking. Able to set priorities, identify partners and bring to life their groundbreaking concepts and solutions that fight diseases and improve human happiness and well-being. Healthcare hackers for the greater good. Do you want to become one? EIT Health InnoStars presents real healthcare hackers, the winners of the EIT Health RIS Innovation Calls for 2019 and 2020. In this podcast series, they share their experiences, the opportunities they identified, and the challenges they had to overcome. Listen in.
Hi everyone, my name is Andrew Wrobel and I have the pleasure to be your host. Today I am joined by Eduard Maron, a psychiatrist and a professor at the University of Tartu and a visiting professor at Imperial College London, and most importantly, the founder and the CEO of DocuMental. They received an EIT grant and they were also named an EIT success story. Eduard, welcome to Healthcare Hackers.
Thank you very much, Andrea. Welcome to everyone.
Fantastic. So let's kick it off with the first question. I already mentioned, your company's name, but I would like to ask you what kind of health issue your company and your team have identified, and what solution you came up with to hack it.
Yeah, I mean, I'm really lucky that we got these names, and actually this name was designed and proposed by my wife. I'm really proud of this because I was thinking, okay, what the name should be used for our solution, which is dealing with mental health issues. And she suggested, so DocuMental. I was thinking, wow, it's just, just really something interesting and very attractive name.
Yeah.
Which is really including the problem we are dealing with, mental issues. And I really love this name, like addressing mental issues rather than psychiatry, because psychiatry is really stigmatized, and just people sometimes quite scared to hear about psychiatry. They think that we dealing with some very mad issues or very just stigmatized disorders. So, but mental issues is very, very prevalent, and it's touching everyone. Because every fourth person in the population suffering from some or another mental health issues, and everyone has someone in the family who has also mental health issues. So it's about mental health.
You had a challenge, basically,
yeah,
right?
It was quite just historical probably decision when I was young scientist, just completed my PhD. And started my clinical training in psychiatry. I was thinking that actually I found it's quite bizarre that our approach in clinical practice is very different from clinical research, where we will use clinical scales or interview like questionnaires, helping us to identify mental health problems. And I was just thinking, it's so obvious. So we need just to digitalize questionnaires and cover all mental health disorders exactly in according to international guidelines, which we have, like ICD-10 still today.
So in practical terms, what it comes down to is that when you are seeing your patient, basically, instead of taking notes, you basically tick certain boxes to make sure that you remember everything right now. And then the system, or the solution that you've implemented, is helping you diagnose the disorder.
Yeah,
is that
absolutely
correct?
right. So what we've done, firstly, we just make structured workflow in according to good practice, because it's called mental status examination. So you never know what exactly is behind of presentation when patients come into to us, and this is how we distinguish good practice from bad practice. Bad practice means, unfortunately, it's very well recognized and described, that usually if you're not using any guidelines is we making decision during first few minutes. So based on our impression. So we think this is depression. We think this is anxiety because person present like person with anxiety or with depression or saying about bad mood, low mood. So, and we making decision based on this impression. But good practice means that you actually looking on whole picture, on all functioning, like all aspects from mood, psychomotor activity, then thinking procedure, how person is thinking, then some delusions. So if there any sign of delusions or any perceptual disturbances, sleeping, eating, sexual activity, physical activity, social activity. So you need to go through all these aspects, and this is what DocuMental is doing.
It seems that the solution is helping doctors directly, but then indirectly, obviously, patients. So if you could tell me how it has changed your life as a psychiatrist.
Yeah, it's changed a lot. It's changed a lot. I'm really enjoying my job now. I would never say that I didn't enjoy this in my past, but it was more stressful because unfortunately our clinical workflow is based on administrative tasks. Was very stressful because I know I have just 30 minutes to speak to patients, understand his or her problem, make notes, make documentation. After that, next patient is waiting. And now I'm really just relaxing in these terms. So I'm just really doing my job. I speaking to patient, listen to patient, and just making very quick like ticks in the boxes and right boxes, and then just follow all these what system is suggesting me to do next step, and really agree or disagree. So it depends on my skills, but the most important, I really save my time. So I'm not so much worry and dealing with the documentation. I'm really dealing with patient issue. I'm listening, I'm talking to patient, and I'm explaining patient his or her issue, he or her problem. And even in the past, for example, I never had such chance to explain patients about biological basis of depression or biological basis of treatment response, because I never had time for that. So only time I had just to speak quickly and just make notes.
So what you're saying now is actually how the patient is benefiting from that.
Absolutely. And I just, because I have some reflection from patients, and I am asking them, are you happy with this approach? Did you get all information you were expecting? They say, actually, I didn't expect so much information because they were so worried and they didn't believe that they can get such important information about how, for example, panic disorder developed and why panic disorder is developed in some particular people, and how beneficial medication, what medication doing, and how they can help themselves to manage anxiety or even panic attacks. And I see that patients become more happy with conversation and with outcomes.
So tell me a little bit more about the process of developing the solution, because when we're looking at the situation right now, it seems like it was a smooth path to what we have right now, but it's never like that. I mean, there's always challenges. Tell me a little bit more about the challenges you had on the way and how you managed to overcome those challenges.
Yeah, it was very long journey because. Firstly, I got this idea to develop in 2006 or 7, something like this, when I was, again, young psychiatrist. And that time, our hospital started to develop electronic health record system. And I was thinking, wow, it's just, this is exactly what I need, because I saw like it's straightforward. If we develop one part for HR system, which is just dealing with mental health disorder, because I probably just want to explain that mental health is very different from any other medical areas where we're using biomarkers or instruments to make diagnosis. In mental health, it's only a medical area where we making decision only based on questionnaires, on interview and impression or observation. And I was thinking, so why not to digitalize these clinical guidelines, as describing clinical presentation, describing treatment treatment guidelines, is treatment navigation. And I was thinking, just do this and implement it in the HR system for to making our job easier and safer and more effective. And that time I was told by colleagues, psychiatry is art, and what you're supposed to do, you just like trying to replace the psychiatric art by machine and replace human by machine. So I just faced, firstly, very strong resistance. So the people were not really happy with this approach. And unfortunately, yeah, just left aside my idea for a while. So I moved to London to just meet my post PhD graduation and studies. And in UK, when I started to work in one of NHS trials, I just realized again that actually I'm using HR system, which is extremely unhelpful. It's extremely taking my time, wasting my time, not helping me. And I was thinking, so this is time to make change. And 5 years ago, I probably made another historical decision, move back to Estonia to develop a DocuMental, and this is how it started.
But when we first talked, I remember you mentioned, that some people were telling you that it's not innovative enough, right? The solution.
2006-7, I was told that it's dangerous. it's not just it's probably innovative, but it's dangerous because the people felt like they are not needed more. The professionals were thinking they are not needed more. If machine or computer or digital solution can make diagnoses, can make propose treatment for patients, select treatment, the most safer and more suitable medication. So why we need doctor? But it's wrong because the machine never work alone. So I mean, even decision support systems still need and required human input, professional input. So I'm deciding by the end because I still doing my job, but system is just helping me. It's assistant. It's my personal assistant, which helped me to remember all diagnostic criteria, to remember all treatment. And again, during my practice with DocuMental, when I just use DocuMental, I was thinking one way. I was thinking, okay, it's very straightforward. This is depression, and system was telling me just look on the decision just appeared on the screen, was just telling about something about personality disorder. I was thinking, where from you take this? Okay, based on my algorithm. And then I started to ask, do you have such problem like with, behavior, with attitude? And person said, yes, exactly. And I asked, what is the major problem for you? This behavior problem, which reflect personality or depression, and person said, actually my attitude to other. I was surprised. Gosh, I would make wrong decision. I would make wrong treatment plan because I would focus only on depression. But
Tell me a little bit about you worked on the project, because if you think the EIT supported project will require a number of different partners. Can you tell us a little bit more about what it looked like in your case?
I believe our case is quite unique because I'm saying that DocuMental is child of EIT Health. This is our third grant funding from EIT Health, which consistently helping us, supporting us, and very proud of that we have so good collaboration, partnership with EIT Health. And it's crucial question, is probably one of the most important question, how to find right partners, how to find right collaborators and team. I was probably lucky when I moved back to Estonia. I found very professional guys, very professional experts on IT technology, and in terms of more broader collaboration and partnerships, what probably I learned from UK is confidence. So I was thinking, actually, I have skills, I have expertise, I have understanding. Why not to share these thoughts with my colleagues, with my international colleagues? I just approach them and say, listen, so this is challenge. So we have problem in our practice. We know how many mistakes we're doing. So what about if we just change these by innovative way, by introducing decision support system, which would help our clinical job, our clinical workflow. And I was surprised that people actually was so positive. Now we have own scientific committee on DocuMental, for DocuMental, and this scientific committee consists top-level experts, professionals from 14 countries. The main factor which was really very contributive and very helpful for us was the fact that every single colleague start to change his or her attitude to his, her job and to patients. And they become more open and saying yes.
You also mentioned that Mental has been or has received 3 grants from EIT. I understand that you applied for the first one, and if you were to look at how the application process, what the application process looked like, do you have any advice to those who would like to apply for similar funding in the future?
Yeah, I mean, yeah, it's very good question again, because even this application is, you probably very often can hear from other people. It's like lottery. Sometimes you can get these lucky tickets, sometimes not. It's very difficult, and we had really also frustration time when our bigger application submitted to EIT Health wasn't accepted by reviewers, and this is fine. This is absolutely fine. This is what we need to learn, not DocuMental team, but every team, every startups who apply for funding from EIT Health. That firstly, yeah, competition is very high. Yeah, it's true. But another, every failure or any rejection never should make you frustrated or giving up. So you need to learn from this feedback. You need to learn from and listen what experts from EIT Health telling you, because you probably focus on some idea, like scientific idea, on innovative idea, and you're still missing some very important part, like commercialization or business plan. And this is how people from EIT Health really, just looking on your projects, like all picture. So how comprehensive, how well designed from scientific part to dissemination part. And this is what we just need to learn. I mean, from other successful stories and from feedback we receive from EIT Health, just to make really good plan, not just development plan, but also commercial or business plan, dissemination plan. And I learned a lot from EIT Health. This is probably one of the best organization and really strong organization in Europe, helping startups and innovative projects. And I learned how we need to change our concept. Even, our idea is very obvious. We would like to help patients. It's understandable. Everyone would agree with this. You would like to help patients. So this is not a question. But the question is how to make it realistic, how to make it happen, and how to make it successful. And this is what we learn. So we were thinking, yes, exactly. So we probably didn't address this properly.
What advice would you give to young scientists who are looking to develop a new solution to help patients, and they're struggling?
Yeah, it's also a good question, because if we give very simple answer, trivial answer, like be enthusiastic, be motivated, active, exploring, believe yourself, be confident. So it's all of this true, but in fact, everyone has own journey and facing own problems or barriers or facilitators. So this is always like two sides of the story. One is restricting, one is like making your life and your journey more difficult, which is also good. And another story, making your development quicker and more successful. And sometimes I see that people who facing this resistance or problems or critical like feedbacks. So they're giving up. They're thinking, it doesn't really interesting. It's not attractive. So I'm probably not ready for this, or probably my idea is not so good, and they're really giving up. So, and they taking it, I would say, so personal, but in the fact everyone goes through the same history. Everyone, all successful startups at some point was struggling with the same issues, with the same concerns and the problem. And I learned very much from one training. I remember one CEO of one company just said that actually when you face such rejection or negative attitude, opinion, or resistance, not take it so personal, but take it with humor, just to turn it from negative side to positive side, because always in the critical view something very important for you, some message which may help you. And when I listen in these critical points, so I'm trying to understand how next time I should to improve or should prepare ourselves to explain in better way why it's needed. And I think when you have startups, I'm absolutely sure that every single idea which is supposed to help patients is brilliant, but you need to firstly be ready to explain it, consistently explain it in better and better way, why it's needed, why it's important, and to demonstrate these benefits. And second, be more positive, even if you're facing these problems, because any barriers making you stronger. And if you're not giving up, you will be successful. You will, just achieve your target, your goals.
It's a great piece of advice. The last question that I have for you is, what is ahead of DocuMental right now? So
now we just in front of very serious development, and it's about regulatory procedures. So we're looking for CE marking. We're looking for quality management certificate, and according to new regulation. And to do this, to obtain this CE marking and quality certificate, so we planning to start quite big clinical trial, demonstrating that DocuMental is firstly implemented algorithms absolutely in correct way, and second, just to demonstrate that DocuMental is really beneficial as compared to traditional approach or traditional workflow. So we're going to demonstrate benefits of DocuMental for healthcare providers, for hospitals, for national institutes, and for patients, of course, for people with mental health issues, and compare how much is beneficial as compared to traditional workflow or traditional approach. So this is our main goal, just to meet these regulatory requirements for quality as a medical device, and then go to broad dissemination and commercialization.
And what's your vision for DocuMental going forward?
Quite optimistic and quite positive. I see this is needed. I see how much is helpful and beneficial, and there's not, I would say, I would not more waiting for next 10 years before I'm coming back to the same idea. So be consistently moving ahead.
Fantastic. Thank you so much for the chat. Good luck with the project. Fingers crossed. I really like.
This was Healthcare Hackers. Stay tuned to the next episode, subscribe to the podcast, and leave a review. And don't forget to check out our EIT Health InnoStars website for more info about the EIT Health RIS Innovation Calls and other opportunities and stories.